Hello and welcome to our video about HIV testing. HIV, or human immunodeficiency virus, is a virus that attacks the immune system, making it harder for your body to fight off infections and diseases. HIV is mainly spread through unprotected sex, sharing needles or other injection equipment, and mother-to-child transmission during pregnancy, childbirth, or breastfeeding. Getting tested for HIV is important because early detection and treatment can significantly improve health outcomes and prevent the transmission of the virus to others. In this video, we'll be discussing the different types of HIV tests, when to get tested, and what to expect during the testing process. First, let's talk about the types of HIV tests. There are three main types of HIV tests: antibody tests, antigen tests, and nucleic acid tests. Antibody tests are the most common type of HIV test. They detect the presence of antibodies to the virus in the blood or oral fluid. Antibodies are proteins that your immune system produces in response to HIV infection. Antibody tests can take anywhere from a few minutes to a few weeks to show positive results, depending on the test used. Antigen tests detect HIV proteins in the blood before antibodies develop. They are usually used in combination with antibody tests for faster and more accurate diagnosis. Nucleic acid tests detect HIV genetic material in the blood and are the most sensitive and expensive type of HIV test. They are typically used for early diagnosis of HIV infection, for monitoring treatment effectiveness, and for detecting HIV transmission in newborns. Now let's talk about when to get tested for HIV. If you have engaged in any activities that put you at risk of HIV transmission, you should get tested. These activities include unprotected sex, sharing needles or injection equipment, and mother-to-child transmission. It's important to note that it can take several weeks or even months for HIV antibodies to show up in the blood after infection, so getting tested too soon after exposure may result in a false negative result. For this reason, it's recommended to wait for at least 2 to 4 weeks after exposure before getting tested. Now let's talk about what to expect during the testing process. HIV tests can be done at a healthcare provider's office, a community testing site, or even at home with an HIV self-test kit. During the test, a healthcare provider will collect a blood or oral fluid sample, which will be sent to a laboratory for analysis. The results can take anywhere from a few minutes to a few weeks to come back, depending on the type of test used. It's important to remember that getting a positive HIV test result can be a difficult and emotional experience. However, it's important to seek medical care and begin treatment as soon as possible to manage the virus and prevent transmission to others. In conclusion, HIV testing is an important step in managing your health and preventing the transmission of HIV to others. If you have engaged in any activities that put you at risk of HIV transmission, it's important to get tested. Remember, early detection and treatment can significantly improve health outcomes. Thank you for watching this video about HIV testing, and stay safe and healthy.